Hello, it's Nick. Today I want to talk about my experience with radiation therapy. In my diagnosis video, I talked about how I had to do chemo and radiation at the same time. This doesn't happen all the time. A lot of the times people get radiation then chemo, or chemo then radiation. My case was obviously that bad. All I can say from the perspective of a patient is doctors, they know their cancer. They looked at my case and they knew I'd have a better outcome if I did these two treatments simultaneously. I think it was during my first chemo that I met my radiation oncologist. He had these amazing green eyes. I was mesmerized. What he said while I was admiring his opticals was vastly unknown to me. But don't worry, I'll explain it all. What I did hear was, once I annihilate your cancer, you'll be one step closer to moving on with your life. He struck me as like the quiet gamer type in high school. Must annihilate all the cancer. I was laying there, nodding my head in agreement. And I was like, yeah, sounds good. Oh my god, you have really nice eyes. I think he gets that all the time. I mean, he has to. Because he was like, aw, thanks. The next day, I was transported downstairs to the other end of the hospital where they do the radiation treatment. The first day of radiation was during my first chemo. I was wheeled downstairs in my hospital bed, and I remember being pretty upset that day. I don't remember why. Maybe my nurse missed a vein. Maybe I accidentally tasted one of my prednisone pills. Maybe my boyfriend wasn't texting me back right away. Who knows? I just remember crying and shaking like a little child. You know when you're upset, you're just winded? You get quiet, you shake, and just trying to collapse in a mental black hole. That was where I was at. But this man, this angel, named Benji, and he was my main radiation tech every day, he immediately made me feel safe. He had this gentle, sweet, and genuinely caring personality. My first radiation appointment was all about the radiation tattoos. Radiation tattoos are permanent guides to help the technician find the exact position to lay you on the table. So the beam will deliver radiation to the exact location of the cancer. These are two of mine. They aren't bad. As you can see, they just look like blue freckles. I was prescribed 10 rounds of radiation to the pelvis. So I had to get 6 of these radiation tattoos. The ones on my left side, which is the better hip, the one that's not as moth-eaten, these tattoos are barely visible today. The right, where the lymphoma had completely dissolved my hip, those are way darker and completely noticeable. Benji was my tattoo artist. It's been a minute, so forgive me, but I believe I was on the table under some sort of scanner, like an X-ray, so he could see where to place these tattoos. And maybe some hospitals are different, but this wasn't a typical tattoo machine that makes noise. This was done with a needle and just placing the ink under the skin. I was terrified because I think I mentioned this in previous videos. I am terrified of needles, especially needles in sensitive places. So like so many of my doctors and nurses, Benji felt bad for me. Are you noticing a pattern yet? He was very gentle with me. And even though the tattoos on the inside of my pelvic region, they stung, he did his absolute best and it was very much appreciated. Once he did one tattoo, he would draw a Sharpie line and then he would cover it with a clear round sticker. I'm guessing that they do this because if the sticker and the Sharpie were to get washed off in the shower, a tattoo wouldn't wash off, it's permanent. I'm also guessing that in the future, if the doctors need to see where you had radiation in the past, they can see exactly where. I'm guessing don't come for me. But after this first appointment, every time after that was very simple. I'd get wheeled downstairs and get greeted by the nicest people ever. There was actually another woman named Nick that worked there, so I'd always get greeted with a, "Hey Nick ×2. It's the little things. Eventually, I'd get wheeled into what I dubbed as the submarine room. The walls looked like thick cement. It was dark in there, and there were fish light murals on the ceiling lights and on the walls, which I appreciated because it was something to look at while you're laying there. There was a big light that said "Beam On," and there was a tiny table with a scanny thingy above it. I'll insert a pic because my description is shit. The techs would get me and my black bag onto the table, and I had this fear that my lines would get tangled up and ripped out of me, so I would always be holding on to them like, please make sure my lines are okay. Benji and Eric were my favorite. They were so sweet. But I don't know, man, there was something special about Benji. I just loved him. He just made me feel like the whole experience wasn't that bad. There were usually 4 radiation techs standing at either side of me. They would use fancy medical terms to either make me move from one side to the other side of the table in that exact perfect position. And then they would say, okay, that's perfect right there, don't move. They told me to be still, and then they would exit. This round thing above me where the laser came out of, it would go turn this way and stop, this way and stop, and it would make Frankenstein and camera noises. And during radiation, I would just lay there and think about everything. The whole process took about 25 minutes, give or take. And it was during this time that it really hit me. I have cancer. I'm literally getting radiation and chemotherapy right now at the same time. Mind blown. Side effects of radiation? Insane, insane, insane diarrhea. I know, so attractive. It was hard to tell what side effects were from the chemo and what side effects were from the radiation. But even on my days where the side effects from chemo were long gone, I'd still have the diarrhea. So that leads me to believe it was from the radiation. One of my friends, who is a 5-time cancer survivor, he said he got really severe burns from his radiation treatments. That did not happen to me personally. And that's actually pretty shocking because my skin is so sensitive. But usually if your skin does burn from the radiation, most hospitals will carry a lotion that you can ask for. Make sure you ask for that shit. Ending thoughts. For me personally, if my whole treatment were as easy as radiation, I wouldn't be sitting here today. But I wanted to talk about this because a lot of people fear radiation treatment, and the fear of the unknown is a bitch. I certainly had no idea what I was in for. Except for the tattoos, thank you HouseMD. I did have a very big complication from my radiation treatment, and I'm saving that for another video. Long term, who knows? But radiation, without a doubt, alleviated my pain, and it helped put me into remission, so 10 out of 10 would radiate again. Benji, if you're watching this, I love you. Thank you for all the love and kindness you showed me. You were a big part of building the strength I needed to kick cancer's ass, and I will never forget you. Na zdrowie, positive vibes. I'll see you in the next one. Bye!